Yes, Vanda, it's really nice to have had you here for these last few days before you leave for St. Vincent. You have been a very good patient from what I heard from my niece Alana, and you even coming here, I can see that you have been a strong, well exercised person because you carry yourself very straight, you're careful, doing your little exercises, using your stick, and safety is very important after the surgery. So you're glad to have you here. And why did you decide to come to Trinidad to do the surgery?
Well, according to feedback that I got from other patients, right? The good doctors in Trinidad would have been able to help me in this aspect, right? So I chose the Southern Medical Clinic, Dr. Francis Mulrain. Yes, and I've been quite pleased, quite satisfied with the service rendered, and just trying to cope now with the recovery part of it.
Yeah, this is a very important part. The
Most
worst is over,
Yes.
but now everything depends on you now.
Exactly.
The doctor has done his part, and now it is for you to do your part.
Right.
So you have to avoid lifting.
Yes.
Be careful when you're coming off the bed at all time. Have your stick close by until the given time that the doctor would have told you. You have to use the stick for support. It's very important that you comply with these things. And on Google, there are some good tips that will help you. In the bathroom, be sure that it's not slippery. Hold on to grab bars, because you don't want to fall, because falling is going to take you right back. Careful with in the bathroom is one of the easiest place to fall. Mats skidding and so wet floors. So be careful with these things, and you should do well. And when do you have to go back out to work?
Well, the doctor given me 2 months. 2 months after the surgery. But if when I get home and I think that I need more, I would have to definitely request.
Yeah, because you want to be sure that you're very well.
Yes.
Because when you go back out to work, if you are fit to work, your employer expect you
to
work and to carry on as though you never had a surgery. So you have to be sure that you are well enough according to your doctor's whatever time he think you need. You be sometimes people anxious to get back to work too, but you want to be healed properly.
Yes.
And even if you're feeling well, don't think you're a super girl or Wonder Woman. I mean, you're strong and so, but caution is very important.
Yes.
Yeah, so it was a hip replacement. What was the problem?
Well, I got a fall, and that would have been probably over 15 years ago. And well, actually the pain started in the calf of the left foot.
Okay.
Right? Well, I went to the doctor several times, and they told me that it's a slip disc in the back there. So I would definitely need a hip replacement. I kind of push it off, shun it off.
So for 15 years, you knew you had to do a hip replacement.
Yes.
And you keep pushing it off.
The pain started to increase as the years go by and so forth. But coming to this stage now, I think, well, I've fully made up my mind. It's time. Time to work on this. So one of my co-workers who actually put me on to the Southern Medical Clinic, as I said before, and I just started to work my way through, and here I am today. I've been gone through the worst part of it.
Yes, of course.
Just trying to cope now.
Very good, very good.
Yes.
Yeah, it was good that your son was here, that he could have been of some assistance
Yes.
to you.
Yes, he's been quite helpful because At times when I wasn't able to even put on underpieces, and he would have been my assistant at
Wonderful.
that time.
Yeah, that
You know?
would have been tough, but was a good
Yes,
experience for him.
Yes.
Because in later life, he may have to take care of a wife.
Exactly.
So children learn by helping.
Yes.
Very good, man.
Mm-hmm.
Very good.
I really appreciate it. Yeah.
But tell me something. This surgery could not have been performed in St. Vincent?
No, we don't have the facilities in St. Vincent to perform this surgery. Unfortunately, not yet.
But they're working towards that.
Well, I would want to think so, and I do hope so. Yeah.
Well, Louise, you're from St. Vincent, so you should have a lot of, a lot of questions to ask about your paternal motherland, as they will say.
Yes, of course, of course. Well, I was in St. Vincent maybe 3 years ago
Okay.
when my cousin died,
Mhm.
3 years ago. And I think that's when I met you at convention.
Okay.
Or would have met you when Mabel picked you up on your way to Sunday morning meetings.
Mm-hmm.
Yeah. And so in the last 3 years, have there been much changes?
Yes, I should think so.
Mm-hmm.
Very much too, especially when the COVID stepped in and changed a lot of things. Everything went kind of upside down, so to speak.
Mm-hmm.
And quite a bit of changes then, yes.
Yeah.
And lots of the friends would have passed on, and not able to really meet as we would have loved to,
Mm-hmm.
but we made it still, and we thank God for that.
Tell me something about the souffle. How did it affect you?
Well, I'm living in the central area, so I didn't really get much, haven't been muchly affected, except for the ashes. The thick ash that would have fallen on house roofs and so on. But in the outskirts of the island, would have been much damage. Many people would have lost their houses and livestock and crops and everything.
How did it affect you when it began to rumble? Were you afraid, terrified?
I was quite scared looking at the ashes going up into the air, up and up. It was very scary, very scary. And then going to bed that night, still not really knowing what to expect. But when we got up on the morning, we were like in a foreign land, so to speak, because all the streets were paved with ashes. Paved with ash. So it looks so foreign,
You felt like you were in Hawaii?
I tell you, So then we have to start massing up and see how much ash we could get out of the, wherever the walkway and so forth.
So how do you dispose of the ash?
Well, we bag up some just for keeping sake.
When you say keeping safe?
Use it
For like
plants and so.
plants, yes, we could probably use down the road in agricultural purpose.
Yeah, be good
As
for
well as
plants.
like a souvenir that we might be able to tell our little ones down the road, this is what we got from such and such an eruption.
Right,
So
right.
you still have that ash after so long?
Yes, I still have some. I still have some put up. And then it was another task now to get the ash off of the house roof, because you have to go up there and sweep it off, and then you have to get your gutterings cleared out and so on.
So all homes had ash.
Yes.
It would have affected the roof.
Yes,
Many
it
homes,
affected
buildings rather.
deeply. Yes.
What about that big river that we used to cross when you're going up to the Carib country? There's a big river.
Dry river.
Dry river.
Dry
Well,
river.
yes, that would have come down with a lot of the lava. Yes, a lot of lava flow would have flown down there. Sweep away a lot of animals and plants and everything straight down to the sea. Yes.
Was there a great exodus after that super eruption of Vincentians? Have they left, gone abroad or something?
No.
Most remained.
Yes, most remain.
Okay.
Yes, most will remain. They're trying to get their houses and so on back in place with the assistance of the government, of course.
Very
No?
good.
Yes.
And your banana industry, how is it flourishing?
Well, that would have gone down too.
Okay.
That would have gone down.
But with the action, so eventually it will be nourished and should
Yes.
be better, yeah?
Yes. So hopefully within the next year or two, things will start flourishing again, agricultural wise. You know,
Because
people
the
have a
ashes
lot
Bobby,
of
Trinidad used to
fertile.
import a lot of bananas.
bananas, yeah.
Mhm. But all those would have been affected during that time. A lot of crops.
I remember going to St. Vincent. I love bananas, to tell you the truth. And Louise had a cousin there. She's passed on. And when I went into the backyard there was a whole heap of bananas. And I said, what are you doing with that? And she said, we feed the pigs. I said, well, here comes another one. I sat in the middle of the heap. And I started to eat bananas. Gosh, it was great. It was great.
I tell you.
When he finished, he was going,
Like a pig.
What about your beaches? How are they now?
Well, the beaches, mostly back to normal.
Which is your favorite beach?
My favorite beach is in the Villa area.
Villa area?
Yes.
Why is it your favorite beach?
Well, it's white sand and mostly it's closest to me. It's reasonably clean.
You don't have a litter problem in St. Vincent, do you? Litter.
Litter problem, not so much in that area. Probably on the outskirts, you might find more littering taking place.
And what are the penalties for littering there?
I'm really not too sure, but I think they do have some sort of penalty where some payment of some sort.
We have an area heading to Waco, heading to Point 14. And over the years, I am amazed that is one of the areas, Point 14, that is really, classy when it comes to litter free. And there's a big sign that says, $1,000 or 6 months imprisonment, something to the effect.
Yes, they will have some fine, but
Well,
of course, things will be kind of slack at times that they don't really pick up on these things.
well,
So sad.
Point Forte being a borough to lands,
Well, we took
You're
a
fine.
borrow too.
they would be vigilant. Also, I was very impressed with your airport, the new airport.
Okay.
Beautiful, user friendly, everything was so orderly and
Well,
very beautiful.
It's my first time flying out on that airport.
Okay.
So you are more fortunate than I am to use it before me.
That was 3 years ago.
I tell you, so this is my first trip out.
Okay, Fitz.
Yes.
And you were impressed?
I'm very impressed with it, yes. Very much impressed.
So, Louise, tell me something. I shouldn't say recently, a couple of years ago, they made a movie called Pirates of the Caribbean,
Yes.
and with Johnny Depp. And I think
One of my cousins,
he acted in it, huh?
yes.
He had a part in it anyway.
He had a part. I don't know how much acting he acted. Might be not my skills,
Yeah, see, I think I saw him running on the
Running
beach.
from the camera. Did you see that movie?
Yes, I looked at it once. Yes.
What you thought about it?
Well, it's not really have really grasped the the full essence of it yet.
You have to look for Jack Sparrow to tell
Yes,
you.
you have to look at it again to really get into it.
But Louise, you have a lot of family still in St. Vincent?
Yes, because my uncle died. I don't have any of my father's siblings, but a lot of children he has and grandchildren. And there's the Koshiers up in Doster Hill.
Yes, I know the coaches.
And you're from Zion Hill?
Sion Hill.
It's
Zion.
the same. It's
Zion.
the same.
The same vicinity.
It's the same,
yes, more or
yeah.
less.
Yeah. Very good, very good. Do you drive?
No, not yet.
Okay.
Not yet.
So all your precautions that you revised since you left the hospital, the idea of sitting and that your hip must not be lower than your knees, and you should be very careful about where you walk, And they talk about loose throws that you might have over chairs, get rid of them.
Because it might
You know,
fall and be
uneven doorways that you have to be very careful. I think they said that you shouldn't be climbing either.
Yes.
You know, you shouldn't be climbing.
Yes, climbing upstairs is kind of prohibited.
Really?
Stairs.
So what is it like at your place?
Well, I have stairs, but apart from the stairs, I have a little
room downstairs.
walkway on the side. So I could get upstairs still, not using the stairs.
Okay.
You know?
Yeah, and then you have
Careful of that.
Kiva, your son, there with you.
Yes.
Can help you. Yes, he's a
Yes.
strong young boy.
Yes, man.
I see he likes football, eh?
Yes, very much
And he's
too.
playing quite good too.
So he should be making your national team.
I hope so.
And then
Yes.
what about your Dr. Gonzalez? Dr. Ralph Gonzalez, he keeping in good order?
Well, I heard today is his birthday. I don't know how old is he now, but today I understand it's his birthday.
Really?
So did you
Yes.
call him and wish him happy birthday?
No, I didn't.
Prime Minister, you did not call your Prime Minister. No, that is terrible.
I tell you.
You have his number, I think.
No, I don't have his
Well,
number.
look at
either.
that. I know my Prime Minister's birthday is on the 24th of October.
Okay.
Really,
Okay.
Yes,
How did you get that out?
because he has the same birthday as Ermin, our helper, ex-helper.
Uh-huh.
So she was proud to tell me she and the Prime Minister has the same birthday.
What are you saying?
I tell
Same year and
you.
everything, the same
Alright.
age.
Same age?
And then
She should get a present for that.
Yeah, I mean-
Call him and tell him. Call him and tell
Maybe
him.
when she makes 75 and he makes 75.
Yeah, they could dance together.
He'll be bending very low.
Oh, so you like Trinidad? I mean, what you have seen of it?
Well, yes, so far. I wasn't able to get around much because of, you know.
Yes, you were here for
But
Yeah.
yes, but it's okay so far. It's okay. I was quite pleased and quite what's the word to say now? Nice to meet the friends. A lot of the friends I was able to meet them in the later half. You know, I was able to get around a little and meet some of the friends and so on.
So you think you would like to come back? I mean, minor surgeries over everything, huh?
Yes,
A
yes,
nice return
yes,
visit?
yes, definitely.
Yes,
Definitely.
You have some spectacular views from the mountains of St. Vincent, eh?
Yes.
The harbour. Louis, you have family up there too. There's a man called Richard, is it? Richard? He lives on one of those high top.
Yeah.
Richard.
I don't think he was related to us though. He's a friend.
A friend.
Mm-hmm.
Yes. Richard and Gloria.
Richard and Gloria.
You have the. I don't know that you know them, do you?
No, I don't.
They have a
know.
butcher shop. Richard and Gloria. He runs a butcher shop. I think at one time, the young, what's his name again? Worker boy.
Yeah.
Yeah, somebody, I don't remember his name now though.
Okay.
I don't know. Can't remember.
Gotta shake up that head, Louis. You gotta shake up. You can't
Yeah,
laugh.
boy.
You can't laugh your way through life, you know.
Exactly. When I'm laughing sometimes it's because I remember, you know.
I really believe you do. You're honest, and that's a good thing about you. You're honest. You know what I mean? That is good. That is really good. Yes, Vanda. So, Vanda, where do you work in St. Vincent?
I am working at a hardware store,
Okay.
Gibson's Building Supply.
You've been here
Okay.
quite a while?
Quite a while. I've been there for the past 34 years.
Wow.
You're a shareholder there?
Long service award just now.
Oh,
Long service
34
award.
years, yes.
Oh, my.
Yes, I
They
enjoy
probably
doing
missing
it
you all
though.
now, eh?
I tell you, very much so.
Yeah, but you have their number to call though.
Yes, I spoke to them recently, a couple of days ago. They called me on WhatsApp and they're ready. Come back, time for you to come back. You're not coming back, you come Trini now, you're not coming back to work.
But it's nice to think that, you know, your colleagues, you know, look forward to your return.
Yes.
That means you have a good relationship with them. So that is very important to
Yes,
have on the
yes.
job, eh?
Yes, very much so.
Yeah. I mean, when you go into retirement, you can look back and say, it was good to work with them 30
Yes,
years. Eh?
yes.
There was something you made with NT.
40 years
Okay.
with LB.
And what you got at the end of it? Oh my. What did you get at the end of it?
Ooh.
40 years.
Oh.
It looks like a big drop of oil.
It is. It is.
Beautiful, beautiful.
Celebrating the pioneers of our future. Louis Baptiste, 2009.
Wow.
So I've been retired all this time. From 2009.
Wonderful.
You enjoy retirement? Louis?
Very much, especially with Lancy.
Have I enjoyed retirement?
Enjoying life, man. Enjoying life.
Vanda, what about you? You look forward to retirement?
Well, I do look forward to that, yes.
What plans you will have for retirement?
Well, I'm late in making my plans, to be truthful.
You don't have too much though, just enjoy life.
Yes, I'm
Enjoy
late
life,
in
Bob.
planning, but I look forward to whatever it would
Yeah.
allow me to.
Mhm.
Yes.
You drive? Did I ask that?
Not yet.
Not yet?
No.
You operate the forklift at the hardware store?
No, I wish I was able to do that. Had I thought in my earlier years, I should have, gone into doing that.
Really?
Yes, I really would have liked to, because sometimes you call in on the main operator to have something move and so forth, and the length of time, they would stay before they could come and do that. Had I my license to do that, I would have jumped on it and gone long time.
So now that you're saying that, tell me something. Do you feel that women's lib, when it came in many years ago, and women opted for man's work, if you want to put it that way, that was a right thing, that you would have supported it? Or
Yes, definitely. Definitely. I would have even loved to be doing delivery, where the trucking is concerned. I would have loved to do that. Really. But I never really thought of it in the earlier, part. But it's too late now.
No, it's not too late. Americans, they get their degrees at a high age, But I mean, to drive is going to be difficult now.
Yes.
But tell me, I mean, those fellas on your roads, I tell you, they zip around corners and they come down the mountainside. They're pretty good, eh?
Very, very good.
Your road depths are not high?
Not that high, but have a lot of turns.
Ah.
A lot of turns, here and there. I don't think my drivers would like to drive here, because they might. I mean, we have a speed limit, yes, but they might get too crazy. Yes, long stretches and so forth.
They're used to the curves.
Yes, they're used to their curves and bends and twists.
Oh my.
Yes.
Well, I want to thank you very much for all that you have shared with us. Louise, I want to thank you again. I want to thank you for your laughter. It always is a good drama piece, So all the best on your return to, when do you leave for St. Vincent?
On Wednesday the 10th.
Okay, Wednesday.
Couple of days off.
Very nice, very nice.
Yes, it was nice meeting you guys.
Yes.
And I do look forward to visiting you again.
That's right. Minus
for
the
everything.
minus the sticker.
Minus the steak. Minus the steak.
All right, thank you.
Bye.